Hi, Dr. Curtis here from Longview Spine and Sports Medicine. Somebody actually recently asked the question, is chiropractic bad? I thought it had to be a joke, of course. Who would ask a chiropractor if chiropractic is bad? It did get me thinking, and I guess I do have an answer. The truth is that chiropractic is bad for pharmaceutical companies. Chiropractic helps a lot of people get out of a lot of different medications, and that's not good for the pharmaceutical world. And they have worked very, very hard to try to squash chiropractic as a result of that. One of the key fundamentals to the whole chiropractic model is teaching people to recognize the things that their body is doing. The things that may very well not be very comfortable and very enjoyable, but nonetheless is doing to try to make them healthier and to help them survive. On the other hand, the pharmaceutical model is more about suppressing all symptoms, regardless if that symptom is good for them or not, regardless of whether the symptom is in their best interest or not. It's just about suppressing the symptom so that nobody ever feels anything unenjoyable. I think one really good example of that, it's the concept of fever. Fever is something your body does on purpose to be able to kill germs. Viruses can't survive in any temperatures over 100 degrees Fahrenheit. So your body raises the temperature to 101, which essentially cooks the virus and kills it. Just the same reason and the way you cook your food. Bacteria can survive a little higher of a temperature, so it takes about to 103 or 104 degree temperature to kill a bacteria infection. Again, it's the same concept. You're just cooking them and killing them, and yet we have been led to believe that fevers are dangerous, and they're scary, and they're bad, and anytime a temperature gets anywhere close to 100, you've got to immediately bring it down. Yet the American Pediatric Academy suggests that you don't medicate a fever until 105. Because again, the protective benefit of the fever killing germs is so powerful, yet most people are being led to believe, predominantly by commercials produced by pharmaceutical companies, that as soon as there's any kind of fever, they've got to bring it down right away. The actual science is that a fever doesn't become dangerous until it hits 107 degrees. At 107 degrees, the proteins in the brain begin to scramble, the same way that happens to an egg when you put it on a frying pan. That same concept can happen to the proteins of your brain and obviously cause brain damage. But that doesn't happen at 106 or 105 or 104 or 103 or 102 or 101. Just like water will not freeze at 34 degrees Fahrenheit. It has to get to 32 degrees Fahrenheit before it's going to freeze. It will not boil at 99 degrees Celsius. It has to hit the threshold of 100 degrees Celsius, and that's when it'll begin to boil. The same is true to the damage to the brain. Pain is a similar kind of thing. Everybody thinks, of course, that pain is bad and that you should do something to get rid of pain. But the truth is that pain not only serving the purpose of letting you know something is wrong, which most people have been trained to and led to believe, that the smart thing to do is just squash that symptom with some over-the-counter painkillers. Pain also serves the very, very important purpose of telling you what not to do. If it hurts, like the dickens, every time you bend and twist to your left, it's because bending and twisting to your left is making the injury and the damage worse. If you have a little small disc bulge that your body has the potential to be able to deal with and fix all on its own, but every time you bend and twist to the left, it makes the damage worse, then you're going to take that disc bulge and turn it into a disc herniation by ignoring the symptom of pain. A pain-killing strategy, whether it is ice or heat or over-the-counter painkillers, or prescription or TENS unit or any of those things, always predisposes you to making your injury and your damage worse. Whereas if you experience your pain, and I'm not saying enjoy it, just allow it to be there, then you will realize that you shouldn't do that because doing that hurts more and it will get worse. Instead, the logical strategy for things like pain or for other symptoms that aren't going away is to try to find out what's causing them, instead of just dealing with the symptoms and masking those symptoms. Find out what's causing the problem, and this is one of the key focuses and key thrusts of chiropractic. It is to get your body back to where it heals and repairs itself by correcting any misfiring in the nervous system, and from there being able to address what's actually really causing the issue and fix that and be done with it, instead of just covering it up day after day, week after week, year after year. Chiropractic is bad for the pharmaceutical companies, but it's great for you, and I encourage you to get checked out and see what chiropractic can do for you.